Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. Another in our series of why even consider vaccination. And in this segment, we still hear people basing their choice on beliefs that might have been up for discussion a few months ago, but at this point have been pretty well settled. So however you feel about COVID vaccination, at least be up to date on what you can know. Don't let yourself be fooled by some of these beliefs. And please, share this with someone you care about. So number one, I hear people say the vaccine doesn't really work that well. Well, note this graph and note the diamond indicating when vaccines became available in December. And unless you think more and more people are strictly following public health protective measures, the only real difference over this time has been the vaccine. Of nearly 180 million Americans fully vaccinated, only 5,000 have tested positive. And compare that with what happened in Manatee County, Florida, where 6 people in an office who shared an office got infected. 2 died. A couple were hospitalized. Only 1 person did not get sick, the one fully vaccinated. So don't kid yourself if your choice is based on a concern that the vaccines aren't effective. That's a myth busted. Second, we hear the vaccines were developed too fast. Now, the timeline was faster than for other vaccines, but for a couple of good reasons. The mRNA technology has been studied for more than 10 years, so it was not an unknown. There was so much virus around, it was easy to quickly see study results. And there was a singular focus across industry, healthcare, and government to make it happen. No steps were skipped. Government financing enabled manufacturer testing to take place all at the same time on the chance it would pan out. And it did. This enabled the process to be accelerated. So don't kid yourself if your choice is being influenced by the thought that vaccines were developed unsafely. That's another myth busted. Third, we hear vaccine side effects are too risky. Now, to really understand this, it's important to separate short-term and long-term effects. The short-term effects have to be judged against the effects of long COVID. Now, what we know is that most people who have gotten vaccinated have experienced a couple days of symptoms after vaccine doses. But that's it. There have been some serious short-term side effects, you must admit that. J&J is associated with blood clots, somewhere around 1 out of 2 to 500,000 people who get vaccinated. And by the way, none of that for Pfizer or Moderna. So if that risk is of concern, these two, Pfizer and Moderna, don't have that risk. Some teens and 20-year-olds have gotten myocarditis, that's an inflammation of the heart, with the Pfizer vaccine, but all have recovered. If you don't like that risk, get one of the others. Now, contrast that with long COVID. 1 out of 3 people who get infected get long COVID, side effects that go on for weeks and months, and in some cases can lead to chronic symptoms. None of the vaccines do that. We'll talk more about that in an upcoming episode. Now, in terms of long-term issues like infertility or autoimmune diseases, the bottom line is both possibilities have been suggested. Neither has been demonstrated in the lab or in the real life. Did a video on that some time ago. You can look for that here. There have been deaths close to the time of vaccination, and it's hard to know if the vaccine caused or contributed, because for most of these people there were underlying other health issues. Now, any death from a vaccine is tragic, but so is a death now that is essentially preventable with vaccination. In the past month, 8,500 Americans have died from COVID. Just about all unvaccinated, just about all preventable. So let's be honest. Whether or not long-term complications from the vaccines eventually do show up, we know plenty about the long-term effects of COVID right now. The point is, you have risk either way, with the vaccine or with the disease. And the question is, which poses the greater risk? So are the vaccines too risky? That's something you'll have to decide. And fourth, for this episode, we hear people say, my body, my choice, nobody else matters. Now, there are many aspects of our lives where this is true. But if we've learned anything, COVID is not one of them. You may get infected and do well, but what about those close to you? So many who have died and gotten long COVID, got it from a family member, a coworker, someone they don't even know, all who did okay. So it is your choice. But if you think others aren't affected in serious ways by what you choose, you're not being honest with yourself or those you care about. So really, here are your choices. Number 1, get vaccinated to protect yourself or others. Or, number 2, if you don't want to get vaccinated, you can still be safe. Commit to continuing public health protective measures. Avoid crowds, and if you can't, keep your distance, limit time around any one person, wear a face covering. Or 3, just hope you don't get infected. Now, when there's not a lot of virus around like we have right now, you might get away with that. But let's be honest, if you choose number 3, what you are really doing is gambling. And like going to the casino, the odds are not in your favor. Just ask those in Missouri in their 20s, 30s, and 40s who wish they hadn't taken that bet. And if you think it's only the vaccine that has risk, you're not being fair with yourself or others. So where does this leave you? I don't know, but I trust every one of us wants to be safe and wants those around us to be well. And if you choose not to get vaccinated based on one of these, what are now myths, don't fool yourself thinking you have thought clearly about this. There's likely something else driving your decision. Maybe that's what you need to better understand and own up to. So be well and be careful, especially right now.